In popular culture, we've been thinking about and theorizing and worrying about artificial intelligence for so long that we've barely noticed how it's already making its way into our lives. As with every technological advancement, its promise is weighed against its dangers. Elon Musk has called artificial intelligence the biggest existential threat to humanity. But two of our panelists today have been harnessing AI to improve experience and outcomes for health and retirement plan participants. One of these panelists has asked me not to try and pronounce his full name, so we'll just call him KC, like Fabio. He is Vice President of Innovation, Research, and Development at Optum, a UnitedHealth Group company, and his work includes, among other things, the use of AI to develop and design more personalized healthcare services. Pia Ramchandani, meanwhile, is the Director of the Artificial Intelligence Accelerator at PricewaterhouseCoopers. Her team is using AI to simulate retirement savings and other behavior to help design more responsive retirement services. Obviously, we needed to bring in a really smart person to moderate a discussion with these really smart people. So moderating the discussion is Steve LeVine, the future editor at Axios, a news startup created by the founders of Politico. He brings decades of journalism experience to subjects like geopolitics, economics, and social impact of robots, artificial intelligence, and new energy technology. We've asked them to talk here today about the potential of AI to shape employee benefits. So take it away, Steve.
Thanks. Thank you, Jason. Thank you, Pia. Thank you, Casey, for being here. Artificial intelligence, AI, is probably the biggest current buzzword out there in business, in politics, geopolitics, and with buzzwords come hype. And so what we're going to try to do today is to cut through and give you as much of a realistic picture of what AI is, where it came from, where it's going, and a practical picture of what it means in the real world. We're going to have each speaker is going to give a short presentation. Then we're going to have a short discussion on the stage, and we invite you to ask questions. There's some sort of an app, I've been told, through which you can filter your questions, and I'll be able to see them right here on the screen, and I'll ask them. Thanks very much. Pia.
Yeah, in true consulting fashion, I've got some text-heavy slides coming for you.
Yeah, the questions
if they can come up
in.
on the screen. There we go. So in terms of why now, why is AI becoming such a big hot topic right now? So far, there's a couple of technological advancements that have been blossoming for AI. One is cloud computing. So being able to run computational algorithms in parallel, you can do a lot more with the types of computers that we have today. Another is big data. So all the information about our lives is being collected, whether it's sensors in cities in terms of smart cities, or it's your Facebook messages. Everything is being recorded about everything that we do, and that data is ripe for analysis, leading to the use of AI to help extract patterns from that data. The last one is actually improvements in algorithms themselves recently to actually understand some of that data better and use it to make better predictions, extract more insightful patterns, and just better understand the way that we live. So some of that technological acceleration that's occurring, combined with some of the changing workforce and the human behaviors that the earlier panelists had covered, have led PwC to focus on a couple of areas on how AI can impact the benefit space. So there's 4 up here that I'll just briefly touch upon, and then one I want to go into a little more detail that was mentioned in my intro. One area we've been doing quite a bit of work is simulating the US population in this virtual environment, kind of a SimCity type game, where we have individuals within a household. They have a family, they can make decisions, they'll face life events around sending their kids to college and facing the college debt that comes with that. So just recreating the world in this virtual environment, because then what you could do is it's almost playing like a video game. So you could say, what happens if there's a massive economic recession? How stable is retirement for our population? Or what happens if we change the design of this product? How does that increase the stability of this population? You could also make individual level advice. So for a particular household, what is good for this particular household? So that's one area we've been doing quite a bit of work, and I'll jump into that in a little more detail in a minute. A couple of other areas we've been doing some work in that we're seeing some rising applications of AI in the benefit space is just plan comparison and evaluation. There's so many different plans out there with dozens of pages within each plan, and being able to, for an individual or a benefits manager, being able to understand what those differences are can be quite challenging. So we've been using some what we call natural language processing, and all this is taking in the text from the plans and summarizing it in a way that's really easy to digest and compare what's actually going on in these plans and what it means for your employees. So that's an area we're also been working on. A third area is something called virtual agents and chatbots. So think about Alexa or Siri, just a virtual agent where you can interact, ask questions, and get advice back. So you can imagine an Alexa for health benefits or an Alexa for financial advice. That's an area we've been working on. The two areas we're focusing on is health advice and financial advice. They're very important for employee lifestyle and overall employee stability even after retirement. And there's a lot of complexity in the questions that are asked, and the resources that are available to them are difficult to mine through, and they're told many different things from different places. So being able to centralize that intelligence and allow it to disseminate using these types of Alexa, Siri type chatbots is actually a really exciting potential future application that's starting right now. And then the last one was also touched upon in the earlier panels around personalized and adaptive benefit products. And so where AI becomes really useful here, I mean, one of the conversations we're having right now about, what happens if you take data from your Fitbit and adjust your life insurance plan accordingly. And even more so, some of the earlier panelists talked about further flexibility in your health benefits. AI can be really useful for figuring out what expected life events people should have and how that flexibility will play a role in making their lives more convenient with their benefits. So those are some of the areas we've been working on. One that I wanted to drill in a little more detail on the next slide, I'm not sure that my cursor is working, thank you, is that SimCity view that I talked about. It's actually, I think, a really exciting area. I mean, it's something that I've been working on, so I'm pretty passionate about it. One of the pieces that's pretty big in this is the first box on the left, which is the data model. And this, I think, has a huge impact on benefits and advice. Oftentimes, people don't know much about what to expect from their lives, and AI could be really helpful for that, because what you can do is you could take information a person knows about themselves or what an employer knows about their employees, like their age, their income, their job, their zip code, potentially their marital status if they have it from their benefit coverage. And then you can impute a number of other characteristics for that household, like their potential financial literacy, their potential health events that could be coming up, other potential life events, when they should expect, upgrading a house or downgrading a house. All of that can be imputed based off of probabilities from other types of data sets. So what we've done is created something called a synthetic population. So we've looked across hundreds of different data sets on different topics relating to behaviors and health and housing, and we've combined them all into one using something, it's a technique called statistical matching, which you don't need to know the details, but essentially just takes data from different levels of granularity and different levels of depth to create a US population representative. So for each person in the population, we've got a record in our database saying, this is what we expect this person to be like. And then what that can be useful for in itself is just the households like you. What does a person like you, what should they expect from their lifestyle? Because oftentimes people don't know. Sometimes they don't even know what their existing financials look like, let alone what's coming in the future. So that alone has been really useful for financial advice for individuals. The second piece in the analytics portion, the second box in the behavioral simulation, is when we actually put this into a simulation model and simulate households and populations forward. So this is at SimCity. At the individual level, you could put a household through different types of decisions that they make, so different benefit choices that they make, or different types of life events they might experience, or different economic environmental changes that they might experience, like regulatory changes, or an extreme recession, for example, that puts their particular job category at risk. So you can get very granular level simulations to look at how well their financial plans fare under all these different scenarios and pick one that's the most robust against all the different uncertainty in their environment. 'Cause we don't really know what's going to happen, and all you can do is try to pick a plan that's going to work the best under what you could expect. And then similarly, at the employer level, you can roll up those household level simulations and look at the employee population and say, based off of the benefits we're giving our employees, what could that do to the employee outcomes? You could start with just looking at their own financial stability and their own household stability, but even go further and say, what does that do to our retention and some of the business outcomes for our company? So that's an area that we've been building out for the last several years, maybe 5 or 6 years, and have worked with quite a few different companies across industries building out these sim cities.
Great. Thank you very much, Pia. Casey?
Great. Thanks for having me here today. I'm just going to set some expectations up front. I do not claim to be an expert in the benefit space. I will say that I am an expert consumer, and I really enjoyed the conversation just a couple sessions ago around buying TVs. I actually think I'm an expert consumer at buying TVs. The best one for you all to buy is the LG OLED 65C 7P. I own 2. They are amazing, the best thing I've ever seen. So I run R&D at UnitedHealth Group, technology R&D, where we look at state-of-the-art technologies, even outside of our industry, and we look to test their applications into healthcare and look where they can apply. The benefit space is really interesting because, as I mentioned, I consider myself a terrible consumer of benefits. I can tell you all the ins and outs of the OLED TV that I own, but I can't tell you very much about my benefit plans, for example. I don't like having to go through and choose them. I think it's still a rather painful experience. But it's more my wife's concern and something that she cares more about than I do. She gets annoyed because I buy too many technology gadgets and TVs and robot vacuums and things like that, of which she knows nothing about and wants nothing to do with, right? So there's this interesting trade-off. And it's funny, I gave a talk not too long ago where I asked an audience of technology people, very different from this audience, if anyone knew how many lines of systems test code was in the International Space Station. And no one raised their hand, but I knew the answer. It's around 11 million lines of code. And it's not because I had any involvement in that work or any experience with it, but I simply Googled the question and found the answer, right? I then asked the group, does anyone know if they're covered for ABA services? And no one actually raised their hand either. And I did the same thing. I pulled out my phone, Googled it. It told me that ABA actually could stand for the American Bar Association, or most likely in the intent of my question, applied behavioral analysis, right? And it's very difficult for us to even just get an answer to that question. And even if I go to our digital applications today and the portals, it's very difficult for me to find that answer. Most of the experiences tell me to read my plan document, of which I have zero interest in doing. They can be like 180 pages long, and I don't even know where to look, right? And so, what I want to talk about is with some of the technology capabilities of AI and the various things that make up AI, there's a real opportunity for us to improve the simplicity and the experience for everyday people like me, so that I don't actually have to have this really in-depth knowledge of how healthcare works and my benefits work, but it's easy for me to find the answers. It's interesting, many of you may have been to our Optum facilities, and we have this, if you've been in there, we have this giant operations center where you can see statistics and all of the sort of massive infrastructure that we have in place. And one of the things we like to tout is how many phone calls we field. We handle something like 200 to 300 million phone calls every year on behalf of all the customers we serve. And every time I see that, I'm like, phone calls? Like, I don't want to have to call somebody, right? And to actually answer the question, am I covered for ABA services, I shouldn't have to call people. And it's actually the number one reason people call in are benefit-related questions, right? And so as we think about AI and the technologies that it can allow us to take all of this information that's buried in these 180-page plan documents and allow them to be served up to people so that they can ask simple questions of it, and have the answers generated for them. So they don't have to go through all that. So I'll talk a little bit about, there's many underlying technologies. Pia did a great job outlining a lot of those, but how we look at them are really in the capabilities that they provide for our consumers, our members, our providers, other stakeholders that we serve. And we see kind of a group of 6 high-level categories. One, the technologies can help automate mundane and routine tasks. We believe there's a lot of cost savings and efficiency savings in the healthcare system that can be realized from that. The second is what I just talked about, answering simple questions. A lot of these answers are locked up in just massive databases, massive piles of documents, things that are generally unsearchable or very cumbersome to extract information from. The third is predicting the likelihood of certain events to occur based on historical and real-time data that comes in. Fourth is notifying, getting notifications or recommendations for someone to take. And then surveilling on top of that, less sort of the spy or big brother thing, but more about tracking the collective events and transactions or interactions that someone has to use that to be able to leverage for additional intelligent use cases on top of. All of that kind of sits on top of increasing amounts of data that the healthcare system is seeing. So I want to talk a little bit about that. The global healthcare data rate is growing at about 50% per year. And what we're seeing is happening is it's outpacing the ability of manual and rules-based systems and retrospective analysis to be able to keep up. So we're seeing these technologies apply the advances in compute power, the advances in the data to be able to move more to real time and to actually handle the massive influx of data that continues to come in. So my next section, why does all this matter, right? These are really great capabilities, and you probably heard a lot of these things in many of the technology pieces, stuff that's being tried today. But I want to talk a little bit about, as we look out, my group spends quite a bit of time kind of looking out to sort of 2025. What does that look like? Where are things going? Why does something like this really matter? And I think there's a few key things I'd like to touch on. One is the national healthcare expenditures in this country are projected to grow by another $2.2 trillion to 2025. It's $3.4 trillion today, going to $5.5 trillion. About 70% of that growth is what we kind of classify as retail-centric care, outpatient, urgent care, clinics, specialty, and more so into alternative sites of care such as your home or devices like this, right? Care will move to software-based modes. And we think that's going to, if you think about that for a second, 1.6 trillion in retail-centric care, you're going to see the number of options for consumers to go get care and seek care grow. And it's going to become more important for them to choose based on various factors of proximity, who's got the best experience, the lowest cost, the best quality. Those things are going to become increasingly important. And we think AI technologies will really help bring more of the environment to the consumers versus forcing them to have to reach out to understand where to go. The other thing that's happening is there's really a convergence of other technologies converging with AI, such as Internet of Things and smart devices and sensors everywhere. It's predicted that by 2025, some estimates are that there will be 1 trillion connected devices on the planet with sensors embedded, all plugged into the cloud and internet sharing data and streaming data. The other thing that we see happening is there's a rise of precision medicine and personalized medicine, specifically genomics and other areas that will help shift the cost curve more towards the determinants of health, which are largely behaviors and genetics, yet they account for almost nothing of the national healthcare expenditures. So we're going to see increasingly, especially upstream in the care continuum, where you think about devices that can monitor your vitals and your activities and then potentially pre-diagnose or triage you those are going to become more critical and provide better experience for consumers because it's going to steer them in to the right place to go. Out of all these retail, et cetera, I don't know. Again, I'm a terrible healthcare consumer, I think, but I oftentimes don't know where to go. Should I go to urgent care, just call my doctor? Do I go to the hospital? Now they have these other, there's popping up all over the place. And more so will pop up via telemedicine, and it's getting harder already to determine what the best mode is for me as a consumer to go. So a lot of these technologies will help on that aspect too. I probably talked way too long.
That's great.
So the TV part was good.
It's a good one.
I need one.
Is LG? I don't
need
know if
one.
LG is in here. But.
So let's unpack this a little bit. Pia, let me start with you. We all have heard, we all think we know what AI is, smart machines. Just from a very high level, what is AI? You already said a little bit why it's different now from what it was, but what is it?
Yeah, sure. And it's also changed a lot, so I can also describe a little bit about that. The broad level definition of AI that we typically use are algorithms that can sense, think, and act. So by sense, it means smelling, hearing, reading, taking in this information from the data that we have, and then computing it, running it through an algorithm, thinking about it, and making some sort of choice, some sort of action. So it could be something like Casey was talking about, taking in all the information from some of the available providers in your space and computing all of the information about it, matching it to what your needs are, what your health issue is, and making a recommendation. You should go see this doctor, it'll make your life a lot easier. So that's the broad-based definition. The way it's played out has actually changed quite a bit over the years. So maybe 30, 40 years ago, it was mostly rules-based. I was actually with a professor at Stanford this summer, and he told me in the 80s, he wrote 4,000 pages worth of if-then statements to identify what to do for an aircraft in different situations. And that amount of time just to write 4,000 pages in itself is really challenging, but to come up with 4,000 pages worth of if-then statements is pretty difficult to even remember what you wrote. So that's how it used to be in the 80s. More recently, models have been built so that you can simulate these aircrafts on a computer, and then the computer seeks out what's the best strategy to take in different circumstances. And so far, computers are actually doing better than a lot of the if-then statements because they understand a lot more of the nuances that humans tend to have a little bit of bias based off of just the information we're able to perceive at any given time. That's also helped us with just understanding different types of data in different ways. So beyond just going further than if-then statements, in the past, with understanding text data, for example, we used to be able to count the words, count the unique words in a document, see which ones are the same, count the number of documents, those kinds of things. Very simple text mining is what they call it. Now we can actually understand the meaning behind words. Computers can actually read a document and understand that joint pain is the same thing as musculoskeletal pain, without a human telling them that those words actually mean the same thing. Machines could actually read through a bunch of documents and extract the meaning of the words, which I think is pretty exciting. And then the next part is it's actually been used to generate content. So generate text, summarize articles, generate imagery, for example. There's a really interesting research project going on at Carnegie Mellon right now where they've been able to take facial images of terrorists where most of their face is covered, and all you see is their eyes, and they could actually use these algorithms to estimate the rest of the face and get a pretty reasonable match in that going from a database of 3 million people, you can narrow it down to 50, which is a pretty strong match, which humans cannot do. So right now, machines actually do a better job with facial recognition than humans. The other area that I've seen big trends and that AI is helping with a lot is just the democratization of data analysis. You don't have to have a PhD anymore in AI to be able to do some of the things we're talking about. There's these toolkits that are available where you just, as long as you have access to Google and a computer, you can go on and then they automate all the steps data scientists typically go through, figuring out which factors are the most important in the data, testing all these different models, tuning the models. It does all that for you so that any business person or any benefits provider can try to make sense of some of the data that they're seeing without actually being a data scientist. So that's been a big trend also.
And then the if-then, just to clarify that, if-then is the original AI
Yes.
where you try to stuff as much data into the machine and just operate off that data versus the thinking neural network AI.
Correct. With if-then, a human has to specify, in this situation, do this. So if the light is green, car moves. Whereas with a neural network, which is just one of the AI algorithms, the machine actually trains over time to learn those statements on their own, so a human doesn't have to specify all of them, because we have our own restrictions on what we can even think of.
Okay. Now, Jason, the way Jason teed this up is the famous quote from Elon Musk about the scary future. You talk, chatbots don't sound very scary. So is AI, when we're looking out there, is AI scary?
There are levels. There are levels. More in the near term, the immediate concerns are around explainability and bias. So AI only learns from the information it's given. And if the underlying data has any sort of bias to it, then the AI is going to be biased. And what happens is these neural net models, they're essentially modeled after the brain. It's very complex levels of nodes and edges between them, and there's data that's flowing between them and different functions. People don't understand what's going on in these models. And they work really well, but we don't know why. And when you don't know why, I think that's a big risk today that we're facing. So for things like benefits, if you're making a recommendation using an AI algorithm and you don't know why it made that recommendation, it could potentially lead a person down the wrong path. There's definitely kind of racial or gender kind of bias that could be in underlying data. There's also just representation issues. There's a famous case in the AI world around a model that was trained to predict risk for pneumonia in hospitals. And what was happening that they found is that the model wasn't alerting anyone with asthma. And they were concerned with that because asthmatics often get pneumonia, and that's a really deadly situation for them. And then they realized it was because the underlying data, asthmatics weren't getting pneumonia because the doctors knew that they were at risk for pneumonia, so they were extra careful with them. So the data that fed the algorithm had no asthmatics with pneumonia, so the computer didn't know that the asthmatics had a risk for pneumonia. So things like that and the underlying data and some of the explainability, I think, are the concerns we're facing today. So there's a lot of work around explainable AI. That's a hot topic. More broadly, I think what's coming in the next couple of years is the concept of responsible AI. So using AI for harm rather than AI for good. I think that's a huge risk. There's a lot you can do with it. I mean, hackers use it all the time right now for stealing identities. Autonomous weaponry, for example, there's a lot of that could be a risk that we just need to understand what is the definition of harm and where does accountability lie. The part that I think is less talked about, but that I'm a little more concerned about, is just that the rate of change going on right now with AI has never been seen before. And what happens in those situations is that we're making decisions every day on how to deal with these things, and we can potentially get to a point where you can't go back. So it reminds me of, there's a book about Homo sapiens and the agricultural revolution, and how Homo sapiens figured out that they could farm. And that's a great way to increase the density of crops per unit of land and feed more people. But it ended up being a lot of work, so they had more children to work on the farms. But then they needed more food. And then they ended up in this really big cycle of really hard labor. And actually, for a period of time before some of the bigger technological revolutions, they were actually living worse lives than they had lived before because they were working more hours, there's higher levels of diseases, child mortality went up, and because they didn't realize what was going on because it was happening so quickly. And that's my big concern, because AI is changing things so fast, and it needs to be an interdisciplinary problem where it's not only AI specialists thinking about it, but everyone thinking about what's this doing to our lives, whether it's philosophers or health specialists or legal specialists. Everyone needs to be thinking about it because it's changing really quickly.
Okay.
I'm just going to add to that real
Please.
quick. I think that everyone gets sort of a vision of Terminator with AI. Now, there's been many meetings where I would love to have my own Terminator sitting next to me in there, but AI, like anything before it, is just another tool. right? It's advancing rapidly, and there's a lot that's still yet not quite understood. It's a bunch of very complicated math. I'm not a mathematician, so it's really difficult to understand what actually happens. Look at the guy who invented the stethoscope. I think he was ostracized at first because this new tool was not well understood, right? And we'll see the same journey happen with AI. Talk about chatbots being scary. Actually, the Microsoft guy is still in the room. There was, within the last couple of years, Microsoft actually released a bot just as a public test. And through interaction with real users, the bot turned into a very racist being, and they had to quickly shut it down because, again, it was not understood what would happen. But it was a really interesting test, right? You also have examples of, I think at Facebook and some other companies who are really pushing the boundaries of AI. They're using it to have AI communicate with other AIs. And there was an example where one invented its own language to communicate with another computer. That is a bit scary because, again, it's not understood what they were saying to each other. It's a language we don't know, right? And so things like that are scary. There's a lot of fears because we just don't know enough yet. And we'll see that advance more, but we have to approach them with this sort of sober mindset. There is a lot of hype, but we have to understand them a bit more, especially applying to them as something as important and sensitive as healthcare.
Just as a note on the last two replies we had about the black box problem with AI, the New York Times Magazine had a very good piece this last Sunday, if that interests you. We are running, we're down to 6.5 minutes. I'm going to skip right forward into the questions. One question that came up, I think it probably rolled past. It was something like, when are we going to see the first, Casey, this is for you. When are we going to see the first robot doctor?
We're already seeing some of them. So there's a thing called the Vinci surgical robot. It's really not entirely automated, I don't believe, although I think that will eventually come. They're more of a virtual piloted robot. So think of like drones being flown. They're actually being controlled by someone almost like on a video game console. Those things are in use today, and we'll continue to see them advanced. I think they're still very early on, but there's advantages to robotics in things like surgery because no matter how good a surgeon you may be, there's always some sort of tremor, right? And so, like everything, there's advantages that technologies like robots can bring, but there's still also disadvantages given the maturity of some of the technology too.
Well, this is a question. So two questions. One is I've read for a long time, and including today, about how oncology, for example, all of the papers ever produced in time, all of the cases, everything will be available on your iPhone, and when you seek treatment, the doctor will be able to come up. Is this happening?
There are many efforts. I think a lot of it that I've seen may be a bit overinflated in terms of the promise and potential, but I believe, just given human nature and our curious exploratory propensity, we'll continue to seek for those types of things, and the technology will get better and better. But I think it's going to be a ways before a machine will replace human in terms of thought. And again, it is a tool, and we as people must think about it as a tool. How best can we leverage it, right? There's a lot of fear over it displacing jobs and all that. It probably will displace some jobs, right? But it'll also create many others.
Well, presumably in this case, it wouldn't be replacing the doctor. It would be informing, this case is very similar to the one you're looking at right now.
Yep, as I mentioned in my little slide, automation is one of the key benefits, right? So my guess is there are physicians who do a lot of really mundane checkboxing and all the other stuff that they would love to be able to automate. And I think those are the areas that should be targeted first. And I think a lot of the benefits we're going to see over the next 5 years in AI and healthcare is not going to be the headline-making stuff. It's not going to be the sexy things that make headlines. It's going to be maximizing efficiency of the back end, automating processes, improving accuracy, predictions, and outcomes.
Okay, let's look at this question here. Will the providers submit enough data so we can tell their quality related to specific diagnosis? I'm not sure what that is. That okay? How? Let's skip to the next one. How can AI connect to total health and financial wellness, teaching employers how to manage costs and maximize benefits through cost understanding and management? Do either?
I could take a shot at that.
Yeah.
I mean, one of the things that we see today is health behaviors of consumers accounts for 40% of their determinants of health. Yet it's only about 4% of the expenditures of health. And I think the more data that's collected about people's actual behaviors in real life, as that moves to more continuous versus very episodic, if you think about it, what data does your doctor have on you? Well, every time you go in for a visit, I may be going once a year, which is probably not enough. But as more and more sensors, whether on, in, or around us, collect data about us, that will more and more be used to connect back with how can we actually tie it to health outcomes, right? And can we get better at correlating and predicting activities to behaviors, and then get better at determining what are the right interventions to take with consumers that will be what I believe they'll move to very hyper-personalized interventions based off of the data that's known about people. And that will just get better and better. It's still early, and it's, we're playing with like shovels and things, but soon we're going to have much more advanced tools.
Are we going to reach a time when insurance companies insist that a robot do the surgery?
I've heard that. People like to make claims like that. I think it is an interesting thought that if it advances far enough, will it be malpractice to do surgery that's not robot assisted or not intelligently augmented by a machine? I think those are very real questions that we're a ways off from yet, but they may come sooner than we think.
Okay. Pia, well, first, Casey, name of the LG TV?
Oh, it's the OLED 65C7P.
Okay, did everybody get this?
Best, hands down,
Okay.
I've ever seen.
We're going to be up here afterward if you'd like that again. Okay, last thing. Lightning round, Pia. How do you teach an AI? But you have to do it in 30 seconds.
In quick summary, there's three main ways. One is giving it training data. So if you have a bunch of images and you say, this is a cat, this is a dog, this is a giraffe, feed it into the algorithm will learn what makes a cat. It has ears. It just learns the different features. The other way is something called reinforcement learning. So you specify a reward mechanism. So this is how gamification AI works. So when AI is playing a game like AlphaGo, for example, or chess, it associates a reward with particular actions it takes, whether it's winning the game or an immediate move, it gets certain points within that game or move to the next level. Those kinds of reward functions can train machines. The last is something called unsupervised learning, where you don't actually train the machine. You let the machine look at all the data and just extract patterns and tell you what it's seeing. And it's not always reliable because a human's not overseeing it, but it could often result in interesting counterintuitive things.
That was pretty good.
30 seconds?
Yeah. So thank you very much, Pia, Casey. That was terrific. Thank you.